Good afternoon, everyone. I'd like to talk for the first time to the community about some work that a partnership of Hamilton Public Health Services, the St. Joe's Healthcare Hamilton, Hamilton Health Sciences, and the Hamilton Health Team have been engaged in with the Scarsin Corporation, where over the past 6 weeks, we've been working with them and their robust forecast modeling system, which they've labeled their decision support system. Now, the decision support system aids local decision-making and how best to minimize COVID-19 infections, hospitalizations, and deaths via public health measures, vaccination, policy measures, and more. Now, it's challenging to introduce modeling, forecasting in a short period of time. So I hope people bear with me. And this is going to be a fairly high level description, but part of what gets built into modeling are what are called key assumptions that underpin how you develop the model, how you develop the forecast, what the coming weeks and months look like. So the key assumptions that have gone into the model that I'm going to show you in a moment are that obviously the current provincial lockdown is in place. It will be in effect for 28 days. But at this point in time, we are assuming that there will be no additional measures, such as has been referred to by Dr. Richardson. As well as has been mentioned, the model has built in the reality of the growing problem with COVID-19 variants of concern, especially the fact that they are more transmissible, they lead to more serious disease and hospitalizations, and they cause more deaths. The assumptions also include that the vaccine supply continues to support Hamilton's vaccination rollout. And finally, a key assumption, because there certainly has been lots of discussion about this, and you've seen the directions that other medical officers of health have chosen in other communities, that the assumption underpinning the model is that the schools across Hamilton will remain open after the spring break. So let's have a look at the model, the current model, and it's a little bit, probably this is the first time visually a lot of people are looking at this, and I want to explain a few features of the model. So this goes back to September. The blue, the jagged line are the daily reported cases that occurred from September up until the current date. The blue bars are the smoothed 7-day average of the newly reported cases. So you can see what wave 2 was like. We had what we call little peaklets, but we got up to a point just around the end of December where we had our maximum number of new daily reported cases, a bit over 130 cases. And around this point in time here, as Dr. Richardson referred to, the province instituted the shutdown, the provincial shutdown with the stay-at-home order. So that took effect and then was responsible for the peaking of the curve and the steady downward trend of cases that we saw during January and February. Now, one of the things to point out is, don't forget, we started back in wave 3 at a much higher number of cases right at this point here. Look at when we started wave 2, very few cases, a much higher daily case count. And so what we're seeing here is the rather steep increase in the number of cases in wave 3, and this is where the forecast comes in. Now, this brown line is the estimated pattern of the cases that we're expecting to see between now and the end of June. But we could be in a worse situation, sort of the space between the brown line and this gray area with the dotted purple line above here. If, for example, variants of concern are more problematic, are transmitting more readily, causing more infections, etc., we could be above this brown line. If vaccinations don't arrive in sufficient numbers, if the achieving of estimated levels of coverage don't occur as quickly as we thought, we may be more in this area. So rather than a peak in mid-May of around 150 cases per day, it might be somewhat higher. These are the things that we don't know, but we assume that this is a likely direction that the pandemic is going to play. And what's going to happen, the reason that the curve will inflect and begin to go downward is largely the impact of more and more vaccines in more and more arms across Hamilton. So this is what a forecast looks like. And what we will be doing is updating this regularly and saying, as our understanding of the growth in cases, as we get a better handle on the impacts of variants of concern, as we see the impact, the growing impact of increasing numbers of vaccines in Hamiltonians, then we will see the downward trend in the cases. But the bottom line is that look at this area under the curve. We have approximately 3 months to go until towards the end of June, we could get down to a level where we step out of the gray lockdown zone in the provincial response framework and get down into the red control level, the orange restrict level, and lower levels of restrictions, et cetera, incorporated into the provincial response framework. Let's have a look at what hospitalizations are projected to be. This graph here shows the total pattern of hospitalizations since the beginning of the pandemic. So you can see the pandemic, wave 1 hospitalizations, the very high daily rate of hospitalizations that we got to at the peak of wave 2. But look at what has happened in wave 3. We are projecting overall a lower peak of hospitalizations than was the case. And a lot of this reduction in the peak of hospitalizations is the result of the heavy emphasis on vaccination in the elderly populations, especially in long-term care facilities and retirement homes. So this pattern is some good news that we expect to see. And here the cumulative hospitalizations, you can see that although the hospitalizations you can see here towards the end of June on into July, the estimation is that we were going to see a flattening of the cumulative curve of hospitalizations. And there's a very different pattern if you look at the over 70 population, because here you see the real impact of the vaccinations of the plus 70 population, especially in long-term care facilities and retirement homes. Although we had a bit of a rise in hospitalizations, there's a predicted dramatic fall in hospitalizations in the over 70s, and you can see the flattening of the cumulative curve on into the latter part of July. But look at what is projected in the 30 to 69-year-olds. This is the lower peak in wave 2, but look at the projected peak that we're anticipating will occur, reaching its maximum sometime in the middle of May, then decreasing as more and more vaccinations start to reverse and cause the downward trend in this curve. But you can see in the cumulative curve that unlike the flattening of hospitalizations in the 70 plus, there is still an increasing cumulative number of hospitalizations. And certainly our hospital colleagues will speak more to this following my presentation. I just want to go back to this slide that I just showed you to emphasize several things. It looks ominous. We've got 3 months before potentially we get down to levels of cases that will allow us to step down out of the gray lockdown into the red control zone. But remember, folks, we are not powerless in the face of this. We cannot control the spread of variants of concern, the prevalence of these more transmissible, more damaging variants. We can't control the international supply of vaccines, but there are many things that we can control. In our households, in our social and recreational space, in our daycares, in our schools, in our workplaces, in our churches, in our synagogues, in our mosques. We can all look at the environments, the policies, the behaviors that can help us through these next months realize that an end is in sight. And the more we bear down, the more we do the things that we know that we need to do on a day-to-day basis, the more that we can make sure that this curve doesn't go into this area, this gray area, but inflects downwards, perhaps more quickly than we anticipate. The other huge thing that we can do is avail ourselves of the vaccinations, get as many vaccines into as many arms as quickly as possible, because this will be the bulwark. This will be the strong, the high, the durable seawall against future waves of COVID infection in our community. So I'll stop my presentation here and turn the floor over to Melissa Farrell, the president of St. Joseph's Healthcare Hamilton.